Welcome back to Living 808. Did you know that the number of hospital visits goes up in the summer months? Having health insurance can help you save thousands for ER visits. And Martha Clopin, Managing Director of Get to Insurance, and our good friend here of the show, joins us with all the details. Aloha.
Aloha, Kelly. Thank you for having me.
Of course. So happy to have you. All right. Now, I was bragging about my fantasy football trophy earlier, but you actually were out there doing something, and you have a little trophy yourself. What are you wearing?
Yes, I did participate in the Hapalua. That's the half marathon. And during these months, a lot of people are doing more activities, and that's how you can actually have injuries. I'm so blessed. It was my first half marathon, no injuries, but I did finish with my husband and my son.
Wonderful. And you have the medal to prove it. I love it. Congrats. And that's a feat, even if it's a half marathon. I've never done that. So props to you.
13.1 miles.
That's a lot. Wow, good for you. Okay, but when we talk about it, as you mentioned, you know, people are out and about more. So do the ER visits really go up in the summer months?
Yes, I was even so surprised to learn that there are more than 11 million visits, ER visits in the summer.
Wow, that's a lot. And so why? I assume it's because people are more out and about, but why during the summer especially?
Exactly. You have a lot of folks who are outdoors more often, and you have a lot of children who are now unsupervised. They're not in that classroom setting. Maybe they're out playing, you know, stickball with their friends, or softball, or skateboarding, or things like that. So you have more outdoor activities. But I was surprised that even adults are often painting, standing on ladders, doing things they don't normally do, and this is one of the reasons for the increase in ER visits. So staying insured is important.
Okay, and let's talk about the cost difference. You know, everyone hopes that they don't have to visit the hospital or have to go to the ER, but these things aren't planned, right? Most of the things are accidents, and that's how they happen. So when it comes to going to the ER, if you had health insurance versus didn't, what is the cost difference there?
Exactly, Kelly. That was also very surprising to me. Let's say, for example, something like a simple broken arm. If you have a simple broken arm with insurance, that's about $100 out of pocket. If you do not have insurance, that's about $6,000. And you know, sometimes people are barbecuing in the summer. You know, the grill master is using the grill. You get a burn, and if you need something called skin grafts, they take skin from one place and put it somewhere else. That can be up to $10,000 without insurance. If you need surgery, skin grafts, pain medications, because a burn can be very painful. So there's a significant difference in cost of these things if you have insurance versus if you do not have insurance.
Yeah, and so that's why you get it. You know, it's a just in case something does happen. You don't want to be bombarded with these huge bills. So who's likely, I guess, to end up without the health coverage for the ER visits?
That's very interesting. You know, Kelly, we have a lot of folks working the gig jobs, like maybe Lyft or Uber, and those jobs don't come with insurance. Also, sometimes people lose their jobs, and when you lose your job, you may lose your coverage. Also, people who have Medicaid, sometimes there's a qualification based on income. If your income increases, your Medicaid can stop, and if Medicaid has been supplying your insurance, you'll need to go out and get your own insurance to replace it.
Okay, good to know. And so that's something that's important to do. So for those that do need to get insurance or replace when they do a switch, you know, it's pretty easy to enroll, as you've told us many times before. What should they be doing?
Yes, there's a site called healthcare.gov. That's the government site that actually subsidizes your health insurance coverage. So people could get covered for a very small amount of money, but a lot of people don't know it because it's a website, and not everybody is comfortable with websites.
Right.
So that's why at Get to Insurance is one of the things that we do as a community service. We'll help people, walk them through, explain it, and we also take training every year with the Centers for Medicare and Medicaid, so we can be a person that's considered local help.
Yes, and they have great local help. You can visit their website, gettoinsurance.com, or of course you can call the number on the screen right there, 808-230-3379. That's your personal cell, right?
Personal
so that goes straight to Martha, so make sure you give her a call. And again, there are affordable options out there, so make sure you check it out, especially during these summer months when you want to be protected. Thank you so much, Martha, for joining us.
Thank you for having me, Hilly.
All right, so much more when Living 808 returns.